Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Kano State Government directs all transport unions to ensure passengers adhere to the use of face masks. Governors of Southeast states agree on use of face masks, compulsory tests for teachers and community testing of the vulnerable group from age 65 and above. And Vietnam closes city of Da Nang to tourists after fresh coronavirus cases, first since April in the country. Total confirmed cases in Nigeria has passed the 40,000 mark after the Nigeria Center for Disease Control (NCDC) announced 555 new cases of COVID-19 infections. The cases were recorded in 17 states and the Federal Capital Territory, with Lagos 156, Kano 65, Ogun 57, the top three states with a total of 278 cases. Plateau State recorded 54 cases, Oyo 53, Benue 43, the FCT 30, 18 was recorded in Ondo, 16 in Kaduna, 13 in Akwa Ibom and Gombe states, 12 in Rivers, 9 in Ekiti, 8 in Osun, Cross River recorded 3, Borno 2, 2 as well in Edo State and 1 case in Bayelsa. 2 deaths were recorded last night in Cross River State. Till date, 40,532 cases have been confirmed in the country, while 17,374 have been discharged. And the death toll stands at 858, recorded in 36 states and the FCT. The Presidential Task Force recommendations for extension of the second phase of eased lockdown expires today. On June 29, 2020, President Buhari approved the recommendations of the Task Force on COVID-19 from the 29th of June to the 27th of July with slight modifications. Some of the modifications included maintaining the national response for another 4 weeks, permission of movement across state borders only outside the curfew hours, the enforcement of laws around non-pharmaceutical interventions by states, the safe reopening of domestic aviation, the safe reopening of schools for graduating classes to resume in preparation for exams, strengthening partnerships with state governments, among others. Well, some of these measures have been implemented, while the reopening of schools has been a subject of debate. The Kano State Government has directed all transport unions to ensure that passengers adhere to the non-pharmaceutical protocols on COVID-19, especially by using the face mask before entering vehicles. Launching the distribution of additional 1 million face masks, Governor Ganduje warned there will be no shortcut to following the protocols of preventing the spread of the virus in the state. He also directed security agencies to enforce compliance in all parts of Kano State. It is the third phase of the face mask distribution by the government, targeting transport, student unions, community-based organizations as part of the efforts under the enhanced established COVID-19 protocol.
All your passengers must use them. Otherwise, the security agencies will stop you from moving from one place to another. And any member who is found in your vehicle without using the face mask, it is your fault, because you are not supposed to take any passenger who does not agree to wear the face mask. That is why we are providing you with enough materials for distribution to our members. And also, you should keep some in your vehicle. Anybody who comes without the face mask, then it's your responsibility to give him, and if he refuses, then you should not take him at all.
Over in the southeast, the governors of the 5 states have agreed on enforcing the use of face masks and the testing of the vulnerable group from age 65 and above. The chairman of the Southeast Governors Forum and Ebonyi State Governor David Mahi disclosed this at the Government House at Abakaliki while briefing newsmen on the coronavirus situation in the region and the outcome of the virtual meeting of the Southeast Governors Forum yesterday. He also expressed worries on school resumption and establishing the physical distancing rule and other measures to safeguard the teachers and students, adding that school infrastructures will be reviewed to support the NCDC protocols, pending when the federal government decides on when it is safe to reopen schools.
We agreed that wearing of mask and social distancing, also going from house to house to identify those who are 65 years and above to do testing on them should be mandatory in the entire Southeast. And we appeal to the religious leaders, traditional rulers, and stakeholders to assist us to ensure that this is achieved. Part of the protocols of NCDC is that you must wash your hands and get sanitized. How many of our schools have running waters? And how many sanitizer has been provided to our schools? Most schools are very bushy now. In the rainy season, schools are abandoned since the month of February. And so what we've agreed in Southeast is that we should do testing on all our teachers. And then review school infrastructure to support NDCD protocols. While we do this, will we be waiting also on the federal government to have their final say on this issue of school reopening? And then will we review our position and tell our people when it is safe to open our schools, and how will we open our schools?
Professor Abdul Salam Nasidi, the former Director General of the Nigeria Center for Disease Control, former Executive Director, ECOWAS Center for Disease Control. He joins us from our Abuja studio. I'd like to thank you, Professor, for joining us on the program.
Thank you, and thank you for having me.
I'd also like to begin by asking what your opinion, or rather your assessment, is of the national response to the coronavirus pandemic in Nigeria.
So far, so good, but I think we could do much better, and to be more on the field and to start addressing the key issues that are making us not really being able to flatten the curve up till now. And this will include, getting to speak to the people, our people, to understand that this disease is real, is spreading, and it's a potential killer that is already killing many people in other continents. So unfortunately, we are still in state of denial, and that is affecting our ability, to be effective in our control measures. So our control measures so far are not as effective as we would have loved it to be.
When you say we're in the state of denial, what exactly do you mean? Because we have the PTF, who is at the forefront of the epidemic fight, giving us the briefing Mondays and Thursdays, and looking at the efforts that they've talked about in terms of testing, also in terms of the non-pharmaceutical measures, which they've asked and said is a bigger challenge, and that's with regards to the compliance. So what particular area do you think we're denying?
Actually, I'm not referring to Nigeria as a country denying, or the government, but I'm talking of the ordinary Nigerian citizenship. Unfortunately, in so many places, so many states, the people we want to meet, to reach, and convince that they should abide by our guidelines and follow the recommendations of the WHO and the NCDC. Many of them are still not believing that COVID-19 is real, it's a big problem, so they are not abiding by those recommendations. So, of course, at the national level, we are ahead of many countries in what needs to be done. So I think we need to start emphasizing a lot on risk communication, community mobilization, and getting people to really come out to understand that, to be safe, you need to, follow these guidelines.
But we have states. We've been told that states and their, commissions for health and the task force, that they need to drive this. They're in charge of the response at the subnational levels. Would you say to a large extent that they haven't done a good job in terms of, the enforcing of the safety protocols in this regard?
Absolutely. Some states have done very well, and unfortunately, majority of the states are not doing very well. They are still under funding, this response and pushing the healthcare workers to the wall. And so some even states, governors are still in denial. It's just the Honorable Minister of Health that has been struggling, to convince them, and in those states, cases are already rising. So if we are to rate general, sub-national response, we say is very poor and really risky. So that's where we are today.
Give us some examples of these states that you feel are not doing well in terms of the response, because some of them could argue that perhaps half of the number of active cases you find them in Lagos.
Yeah, this is because Lagos is doing very well, testing more than every other state, really trying to be on top of the problem. Unfortunately, the virus is in the community ahead of us. But states like, Cross River, and Kogi still remain largely, in denial, especially from the executive level, and they are not really taking this disease to be serious as other parts of the world is taking them. There are other states in the north who are also not as very serious as we should have loved them to be. For instance, Zamfara is not doing as well as we should have loved, and so on and so forth. So you could name more, but for now, we're happy that a lot of the governors are now warming up, picking up, and understanding that, this is a potential killer that could be more dangerous than some of the wars we are fighting now, including Boko Haram and banditry. We saw what is happening in Latin America, where the disease landed not long ago, killing thousands, especially Brazil, where within a couple of weeks, more than 2 million people were infected, and already they have about how many 600 deaths, which is really worrying. 600,000, which is really worrying.
So finally, in terms of perhaps, the way forward, how can states and the NCDC work better, and this is to achieve maximum results, reducing the community infection spread?
The NCDC needs to work with their counterparts at the state level, and the Minister of Health need to lead this fight, especially working with other ministries that are very important, like Minister of Information. This is the stage we need them very, so well that Minister of Education, Ministry of, I think Information and Culture are now the same, to mobilize the communities. And the NCDC is already doing their best, but their best may not be enough for now. That is, the area they need to work is to ramp up the tests. Number of samples people tested so far is too low. We need to expand the laboratory capacity because to be safe and to actually flatten the curve, all we need to do is to increase and expand our capability to test and detect disease early. And then, the earlier you detect the disease, the better it is for the country. You'll be able to prevent the disease progressing into severe forms. And then also you'll be able to prevent transmission from somebody who is infected and already sick to other people. So testing and encouraging social distancing and some of the key areas that I think the NCDC can concentrate on. Lastly, the NCDC must start working with other CDCs and other institutions that are developing, preventive measures like vaccine development, development of anti-sera against the virus, and other non-pharmaceutical methods to really fight this infection. Already this has been done at the national level and African Union level, where we are now going to start actively participating in developing these vaccines, even though our role for now is participating in the clinical trials. So Nigeria has prepared some states. Yeah.
We'd like to thank you. Wish we had more time. Hopefully you'll join us again. Thank you so much, Professor Abdul Salam Nasidi, former Director General of the Nigeria Center for Disease Control. Thank you for joining us on the program.
Thank you also. Thank you.
We have more on the COVID-19 updates when we return. Stay with us. Welcome back. Joining us via Skype is Professor Oyewale Tomori. He's the Chairman, Ministerial Committee on the COVID-19 Response, former Regional Virologist of the WHO Africa region. Thank you for joining us.
Thank you very much.
All right, Professor, I want to start with the infection spread across the African continent. Have there been any successes? And this is in spite of the rise in COVID-19 cases.
No, I don't think we have had much success as such, because many of the countries we are still seeing rising number of cases in the different African countries. Some of the ones where we are not getting results is just that they are not reporting, not because there are no cases. So I think we are still climbing up. We have not flattened the curve yet.
So if we look at the West African region, Nigeria is number one. Afterwards, you have Ghana. And in the last week, I think Nigeria tested about 48,000 in a week, but we're still far behind. How can we improve our testing?
Well, what they're doing now, you need to get more labs. I think currently we have about 60 laboratories that are testing. This has, after about 4 months, that we're able to get 60 laboratories in place, which I think is very slow. I also believe that if we had used what we had before, what we call the Gen Expert laboratories that are all over the country, about 400 of them, if we had started with that around March, I think we'll be in a better position than now. It's only now that I think only 16 of them have been repurposed for COVID testing. But this is what we should have done way back in March. And we'll probably be in a better position than we are now.
What advice have you been giving as chairman of the Ministerial Committee? Because we're seeing, more than half of the active cases which are in Lagos. What more are they doing to reach, our peak and then flatten the curve?
Well, the committee has given advice on various aspects of the control. We looked at the issue of the laboratories, which I already mentioned. We have looked at the need for us to have local capability to validate many of the kits that are coming into the country. We have looked at possibility of the issue of the case management. I think what's more important is the need to get right down to the data that will assist the country and do a proper analysis. By data, I mean, let me give you an example. So if we say 500 samples are positive today, it is important to know, were they all collected the same day? Were they collected 10 days ago? Were they collected 5 days ago? It's only then we can actually know exactly how the epidemic is going. What we are getting right now is what we call result curve, not an epidemic curve. And if you're following on that one, you're always going to be behind the epidemic. And by the time you know what is happening, it already spread beyond your capability. Over.
So now in terms of the risk, are you saying that the country is more at risk as there might actually be more than 40,000, way more than 40,000 confirmed cases?
Oh, definitely. I'm sure we have more than the 40,000 cases we are talking about. And first of all, if you look at they did a study, the same group at the NCDC, in which they look at the number of people who are the positives. About 700 of them are people who have traveled from outside the country. And you have another 2,000 or so, about 25%, who are the contacts of these people who traveled. But then we have a whopping 75% of which we don't know where they got the infection from. And if you don't know where they got the infection from, you don't know who gave it to them, you don't know who they are contact, you can't trace them. And of the number of case positive we have, how many of them are actually in the hospitals? How many do we know where they are? A lot of people are positive and who are not showing symptoms. So if we're not following the guidelines which the government is giving, these are possible sources of infection to other parts of the world. And if it takes me 1 week to know that I'm positive, I could have been anywhere in the country, with spreading the disease, So these are the problems that I think we need a proper analysis of the data that we have to ensure that we're actually monitoring and focusing on these epidemics. Who is contacted, who has the disease, which contact do they have, where are they in hospital, are they at home? All these are questions that we need all that before we can do a proper control of the epidemic.
Finally, Professor, if you can, in just a few seconds, based on what you've said, based on what it is, according to you, based on the data that currently exists, can we say that it is safe to fully reopen the economy?
Well, you see, one thing about the economy depends on the people. I mean, if you follow the guidelines that the government has put in place, gradually, you should be able to do that. But then you have to have certain set conditions which has to be fulfilled. And particularly the people themselves, we ourselves as people must abide by those rules and regulations. If we don't, you can lock the place up, you can ease it up, the disease will continue to rise until there's no more person to be infected in the country.
Thank you so much, Professor Oyewale Tomori, Chairman, Ministerial Committee, COVID-19 Response. All the best. Thank you for joining us on the program.
It's my pleasure. Thank you very much.
Vietnam has closed the city of Da Nang to tourists after new locally transmitted coronavirus were recorded, the country's first since April. Authorities have ordered the evacuation of at least 80,000 tourists in the area. Meanwhile, globally, the total number of confirmed cases has reached more than 16 million, up by 1 million in just 4 days. Here's more on our COVID-19 global update.
Vietnam is evacuating 80,000 people, mostly local tourists, from the central tourism hotspot of Da Nang after some residents tested positive for coronavirus over the weekend. The Southeast Asian country is back on high alert after the government on Saturday confirmed its first community infection since April and another 3 cases on Sunday, all in and around Da Nang. The evacuation will take at least 4 days, with domestic airlines operating approximately 100 flights daily from Da Nang to 11 Vietnamese cities. Australia's Victoria State on Monday reported the country's highest daily increase in infections, prompting the authorities to warn a 6-week lockdown may last longer if people continue to work while feeling unwell.
It's just a matter of fact, we have too many people who have symptoms and they are going to work. And what that means, even with mask wearing, even with hand hygiene, even with distancing, that is an unacceptable risk in terms of transmitting this virus. That is what is driving these numbers up, and the lockdown will not end until people stop going to work with symptoms and instead go and get tested because they have symptoms.
The second most populous state reported 532 new cases of coronavirus, the most new cases in a day since the pandemic arrived in Australia, and 6 more deaths, taking the state toll to 77, almost half the national toll. South Korea says the man suspected of being North Korea's first confirmed COVID-19 patient did not have the virus. The man apparently defected from North to South 3 years ago before seemingly deciding to return last week. South Korea says the man reached the north by crawling through a drain pipe on the southern island and then swimming about a mile. And for the first time in the modern era, amidst efforts to curb COVID-19, Muslims from abroad will be unable to attend the Hajj pilgrimage in Saudi Arabia as the authorities order a deep clean of Islam's holiest sites in Mecca. This is in a bid to minimize the risk of contagion from the coronavirus pandemic. This year's event has been limited to about 1,000 pilgrims from within Saudi Arabia, 70% of whom will be foreign residents of the kingdom.
For more updates, take a look at our website, channelstv.com. It has the latest updates on the pandemic. You can also find several news there. That's channelstv.com, all at your fingertips. Thank you for watching. I'm Millicent Walker. Stay safe.